Welcome back. Now in our health sector this evening, we're talking about strokes that are sudden and serious, but knowing what to look for and acting fast can make all the difference. Tonight we have Dr Magano Akuuake, emergency medicine specialist at Welwitchia Hospital, to break down the signs, the responses, and how to protect yourself and your family. Dr Akuuake, good evening. Thank you so much for joining us here on the Daily Roundup.
Good evening, Nina. Thank you for having me.
Well, just to start with, Doctor, in your own words, explain to us what, a stroke actually is and what happens in one's body when someone experiences it.
Okay, thank you. The brain is an organ just like many other organs in the body, and it has a lot of blood that is going to it. And this blood is supplied by blood vessels. So what happens with a stroke is that there's a blood vessel that either ruptures or there's a clot within that blood vessel that now interrupts blood going to the brain. Now, the brain is responsible for how you walk, talk, how you're thinking. So if there's blood that is interrupted and there are brain cells that are dying, that means that there is function of the brain that is being damaged as there is no blood that is flowing. So that is exactly what happens with a stroke.
We've heard about the FAST method, Doctor, which helps you identify a stroke quickly, the FAST. Just explain this to us.
So the FAST is an acronym that is very easy for many people to remember to be able to recognize a stroke quickly. And it consists of 4 things. So the first one is F, which stands for face, where part of the face or half of the face starts to droop. A stands for arm, where you ask the person to either lift their arms and they're not able to lift them, or the one arm starts to slowly go down or drift down. The S stands for speech disturbance, where the person starts having slurred speech, or they're saying that their tongue is very heavy or they're not able to speak at all. And T, which is one of the most important, is for time, where we have a 4.5-hour window for us to get a certain medication to this patient if it is a clot, and that's why we emphasize it. And the patient doesn't have to have all 4 of them. Even one of them is important to recognize the stroke and bring them to the nearest emergency center.
Talk to us about some of the main things, Dr. Akuuake, that leads to actually having a stroke. Is it health-related, lifestyle-related? Just unpack that for us.
So the major causes of stroke is usually lifestyle related. So it's smoking, excessive alcohol, hypertension or diabetes. And especially nowadays, there's a lot of people who are walking around who don't know that they have diabetes or hypertension, or they do know and they're not taking their medication, which makes them uncontrolled. But what's interesting is that we are seeing a lot of young people coming in with strokes that are related to sexually transmitted infections. And this is something that not a lot of people know, that HIV and syphilis, which are both sexually transmitted, put you at an increased risk of developing a stroke. So those are part of the risk factors that we need to be aware of.
Let's pause there for a second. I just want you to further explain that, how a STI relates to you being susceptible to having a stroke.
All right. So what happens is that both syphilis and HIV give you a vessel type of vasculopathy, where the vessel becomes affected and puts you at increase or a chance of developing a clot, which is now the reason, which is one of the type of strokes that we're talking about. Yeah. So hence the getting early tested, prevention are all important to make sure that you don't fall into that category of getting an STI and therefore developing a stroke because of it.
Thank you so much, Doctor. So I want to talk about how one can lower the risk of having a stroke. Let's talk through diet, because obviously what you've just explained, that the best option there would be abstinence or just using protection when you are sexually active. But now in terms of lifestyle, etc., that you mentioned there, which is a big contributing factor, how can you minimize your chances there?
So as you said, lifestyle is very important. So exercising, having a good low-fat diet, low-salt diet to control now the blood pressure as well as your diabetes. Exercising, decreasing smoking is actually a very big risk factor for stroke. So stopping smoking, not even reducing, stopping smoking, stopping excessive alcohol or no alcohol at all, lowering your cholesterol. So regular follow-ups with your doctor are actually very, very important to make sure that you pick up these risk factors early. And then, as you said, the sexually transmitted aspect of just prevention, one partner, condom use, and then early testing for HIV and getting treatment as soon as possible.
I also want to know, Dr. Akuuake, is there a spectrum in terms of how bad a stroke, can be? And then what would be the contributing or defining factors, for stroke to be low impact or high impact, if I can phrase it as such?
So what happens is that with every minute that passes by, there is a number of cells in a particular area of the brain that are getting affected, which means that you're losing function as time goes by. So the longer you are, or a part of your brain is going without a blood supply, the worse the stroke actually becomes. And therefore, you decrease the chance of you recovering fully from the stroke or even surviving the stroke. So that's why we always emphasize the time element of recognizing the stroke and getting the patient to the hospital as soon as possible. At this juncture, I'd also just like to mention that there's a myth that goes on where people feel that they associate a stroke together with a heart attack, and because of the clot element. So they give their family member either a Disprin or a grandpa because they're trying to make the blood thinner to try and open up the clot or make it blood flow faster. But we need to know that there's two types of strokes, and we can't differentiate between the two of them clinically. The patient has to go for a CT scan. Yeah. So if you give someone a blood thinner when they're actually already bleeding, you're just making the stroke worse. So when you recognize that someone is having a stroke, don't give them any medication at all. Make sure that you get them to the nearest emergency center as soon as possible.
Just lastly, doctor, after someone has, had a stroke, what kind of care or rehabilitation is needed? And of course, talk to us about the family aspect in terms of, support during this recovery phase.
So it depends on how bad the stroke was. So if it was just a minor stroke, physiotherapy, just for them to start walking, moving their limbs will be sufficient. But the worse the stroke is, you will need a lot of more allied health. So if you're not able to speak, you might need to get a speech therapist just to assist you to start speaking again, but also swallowing. Occupational therapists to assist you in just getting used to bathing yourself, eating by yourself again. And then other allied health practitioners will also be involved in the whole rehabilitative process to make sure that cognition, your attention and memory also gets better. From a family perspective, psychosocial support, especially for young people, it is difficult to know that you were independent, you were doing everything by yourself, but now you are basically dependent on other people, many other people to get by and just do basic things. So support from the family is very important, but also whether psychologically and spiritually is also important for these people just to get through this very difficult time in their life.
Well, Doctor, any final remarks you'd like to leave for us on this very important topic?
So it's just important for us to recognize how to recognize the stroke. So stroke awareness is very, very important to lowering your risk of developing a stroke through or mitigating these risk factors that I spoke about. And then lastly, getting to your emergency center as soon as possible so that we treat you either with medication or other interventions to improve your recovery.
Dr. Magano Akuuake, thank you so much for your time this evening, and thank you for joining us here on the Daily Roundup.
Thank you, Nina.
That was Dr. Akuuake, who is an emergency medicine specialist at Welwitchia Hospital, just speaking to us about the signs of stroke, the contributing factors to it, and how you can look out, using the FAST method to early detect if you or somebody else might be having one. I hope you've learned a thing or two. When we come back, we talk Windhoek Fashion Week.